One of Australia's largest private healthcare providers has collapsed into receivership but says its hospitals will keep operating as normal. Healthscope, owned by North American private equity giant Brookfield, has been placed into receivership by its lenders. McGrathNicol will now take over running the heavily indebted company and look to sell some or all of its 37 hospitals. Health Minister Mark Butler says this decision is not unexpected.
We've been meeting as the government with Healthscope now for some considerable time as speculation about this decision has been really been spreading through the community, and made very clear our expectations that the interests of patients and hardworking staff will be the highest priority through this process once it eventuated. I want to be clear that I expect to see an orderly sale process eventuate from this decision to a new owner with no impact on patients and no impact on hardworking staff.
And Healthscope CEO Tino Laspina outlined the reasons for why the healthcare provider is struggling.
I've been here for a few months and I can say the business had three core issues. One of them is there's been too much secured debt, and that's being addressed in this process. The other is the rentals that the company are paying are out of the market, they're too high. That will get addressed as part of this process. The third, as has been widely spoken about, is the industry structure with private health insurers basically having squirreled away billions of dollars over the last few years and not putting it back into the private sector. That is a fight for another day. What we're talking about here is a process to address those first two issues.
Well, let's bring in finance reporter now, David Chow. David, I know that you were watching both those media conferences by the Healthscope CEO and the Health Minister Mark Butler there. An orderly transition of sale is really required to keep, 19,000 staff employed and the hospitals running as per usual. Take us through that process.
Sure, Kath. So Mark Butler, the Health Minister, did make it clear that it's his expectation it'll be an orderly process. So he said there should be no impact on patients, pretty much echoing what was said in the press release that Healthscope released this afternoon, where they also said they're not expecting an impact on patients, doctors, nurses or workers. So in the health release, I noted the wording, the intention as they sell off Healthscope to a new owner is that there'll be no hospital closures or redundancies. But I noticed the key word is intentions. Sure, I mean, it's a statement of intent now that none of these groups, workers and staff will be affected, but let's see how it plays out in practice, Kath. Now, Tino Laspina, the CEO of Healthscope, we also heard from him. It's interesting that he mentioned numerous reasons for the financial difficulty the company is in, and he identified rent as a major issue. So you just have to go back to the year 2019 to see why it became an issue. So that 2019, the year before COVID, Healthscope was bought out by Brookfield, which is a private equity firm based in Canada. And after the sale, Brookfield sold off 22 of Healthscope's properties for $2.5 billion. And then it rented those properties back to Healthscope. And since then, we know there's been a humongous surge in inflation, particularly rent. There's been elective surgery cancellations, especially during the height of COVID. The trend more towards people staying for day surgery rather than staying several days, and wage increases to keep up with inflation. So that's just compounded the financial difficulty of Healthscope, which is facing debt of around $1.5 billion, which was the subject of a meeting earlier today among lenders and creditors, which ultimately decided let's put the company into receivership, i.e. Selling off its assets in order to recoup that debt for the biggest, top secured creditors. Now, Healthscope, for those reasons, is not a profitable enterprise. It does have 19,000 staff. 37 hospitals, so a lot of people affected by this decision. So the key message I'm trying to emphasise is that the staff and the patients should go about their day-to-day business, because it's the parent company that's in receivership, not the operational day-to-day companies.
Yeah, the CEO was pressed about whether or not the entity would be sold off as a whole entity or in parts. What did he have to say about that?
Well, I guess the intention, I guess, is to sell off as much as possible in order to recoup that debt. So certainly anything is on the table. I mean, there's some speculation who the buyers might be. The most likely candidates would be insurance companies or similar type of private hospital operators, like Ramsay Healthcare has been floated around as a possible name, as well as Catholic Care. So look, this is still the very start of the process, and anything could happen. And the statement of intention that it's business as usual, hopefully that remains the case, but who knows, that could change.
And something that might take up to 12 weeks, the CEO was saying there. Dave Chow, thanks very much for your analysis.
No worries.